Hi, everybody. It's a great pleasure to share my thoughts on my own review process with you. It's a great pleasure and it's an honor to be a reviewer for quite a while for CVIR, because to my opinion, this is the best journal for interventional radiology. When you start reviewing, it's important that you have some prerequisites. And the prerequisites are that you have knowledge of the current literature. So you have to read a lot. You have to be active in the field, participate in meetings, discussions, workshops. And you should try to publish own work in highly ranked journals, because that helps you to deal with reviewer comments and to get a feeling for what is important and what is less important in a paper. And try to review as many papers as possible, because it's like with every other stuff, training makes you a pro. When I get a request to review a paper, I think about the topic, whether it's interesting to me or not. Does it really fit into my field of expertise, or do I don't understand what's going on? Sometimes, of course, you can also review papers that are not your main field of expertise, because once you are trained in reviewing papers, you can also read through the structure and understand what the authors are doing and authors are trying to say. So you should, in first place, stick to your expertise, but the broader your spectrum is, you can also review papers that are not on your main focus. And of course, this is important to CVIR, because you have to be on time with your review, and it's part of the quality of a journal that you review on time. And this is on from my own history, showing that I try to stick to a couple of days with my reviews at maximum. What I do in a first step is I schedule my review, which helps me being effective on my review, and I start printing out the paper. Yes, I still do that. I don't read it online. I print it out because I can take notes on that very easily, and I like to do that with handwriting. I look at it, if it is a first review or is it a revision, or have I reviewed it and I get a revision. Sometimes you get a revision without being the first review. And then I start with this by thinking about looking at it. What type of study is it? We all know that the most important and best valid studies are randomized controlled trials, experimental studies. But what we have to deal with in most of the submissions are observational studies, which are descriptive studies. This is a negative aspect of our research in medicine in general. But of course, we know that setting up randomized controlled trials is very time consuming and sometimes not very effective. So you will mostly deal with observational studies, which has some negative aspects to it, but that's what you mainly encounter in medicine. In my first read, I try to look at the abstract. Is it logic in itself? It should be possible for the abstract and for the reader to understand the core of the study from the abstract itself. Is the paper, the read, easy to follow? And what's to me always important is theoretical approval with respect to the study design, which means, of course, prospective randomized trial will always have patient approval with it, while retrospective studies do not require that much of ethical approval. Are there any obvious methodological errors that might already lead to rejection of the paper? And what you often see is that the conclusion does not really fit to the methods and the results. So these are points which I try to look at when I do my first read. And sometimes, unfortunately, it's already clear that the paper won't make it to my own second round. In that respect, of course, the author will still get feedback and comments that might help in the process of either submitting the paper to a different journal or to increasing the quality of the study. In my second read, I'm assembling my review in the structure like the paper is itself. The abstract should be a condensed version of the paper, so it should be able to stand alone. And at the end of the abstract, at the beginning of the abstract, the hypothesis must be clearly defined, and the conclusion should follow the results and should not be vague. The introduction is usually one side and should be short, and it should explain the most important aspect of the background of the paper, and we should end with a logic hypothesis. In the material and methods section, it should start with the statement of the ethics, depending, of course, on the study design. And I would strongly recommend for everybody who is in the research field to get familiar with the guidelines of good clinical practice, which are published by the International Conference on Harmonization of Technical Requirements for Registration of Pharmaceuticals for Human Use, because that helps you by setting up your own studies, and it also helps you by assembling papers, and it certainly helps you by reviewing in the reviewing process. As I said, the ethics should be in first place, and the methods that are chosen should be able to answer the research question. That also includes the number of patients which are necessary to come to a certain conclusion. This is one of the major points that is not always clear in the papers. Why, for example, use 80 patients for a certain clinical question? There should be a clear hint on how the number of participants or examples in the paper have been acquired. As I said, we're mostly looking at retrospective study designs. That usually implies that there is a certain time period that has been looked on, which then comes up with a certain number of patients. But in general, if you have a clear clinical question, you should be able to calculate a number of patients that you need to answer your questions with a certain methodology. So I can always recommend to get into deeper knowledge of statistics. That is very helpful in writing papers as well as review. What I like is when I read the result sections in the same way like the material and methods. If you have point A, now patient inclusion, then you start with your results, which picks up the same point again. That helps in reading the paper, and it helps us as the reviewers to follow the thoughts of the readers. Of course, same thing, are the numbers logic and easy to follow? I usually personally don't like it if a paper is full of numbers which you cannot really put into perspective. Sometimes it's easier to have a nice table to look at and analyze the numbers. That should all be logic and easy to follow and understand. And of course, at the end, it's about the hypothesis. Is it possible to support the hypothesis with the results in the way they are presented? What we often see is that in the discussion, numbers again are presented from the results sections. This is not the point of the discussion. The discussion is not a repetition of the results. The results should be discussed, yes, but in the context of important current literature, which is dealing with the same or similar topic. And as I said that earlier as well, the conclusion should follow from the results of the paper in a way that it's logic and it has a direct answer to the hypothesis that has been formulated at the beginning of the paper. What I have encountered several times, it's quite common, I think, there is an unclear study design. Sometimes it's not clear whether it's a real retrospective or a prospective study. Authors tend to present many, many numbers, which can be very confusing and which sometimes do not follow the methods. And it's sometimes unclear there's unclear explanation of the methods of the selection, as I said that, and this usually leads from a statistical point to a bias of the paper. And at the end, there comes the sad point of, do I accept the paper, which is of course not sad, which is good. Do I recommend a revision, minor or major, or do I reject the paper? I always try to formulate constructive reviews, even though if I reject a paper. My personal way of looking at it is the main question, do the comments that I make are so severe that they cannot be resolved, or the other way around, can they be resolved in rewriting the paper? Or are there methodology errors that cannot be resolved? And furthermore, it's always important, the scope of CVIR, high quality, broad audience in the world, is the quality good enough for CVIR? And another aspect that every reviewer should have in mind is if the paper is not yet suitable for CVIR, but CSA has also other journals like CVIR Endovascular, which is a potential other publication way, and could the publication be transferred to that journal. And with that, I would like to thank you for your attention, and I hope I can answer all of your questions in our workshops. Thank you very much.